Hi, I'm Ruth, physiotherapist at Complete Pilates. This is a blog all about the benefits of Pilates for osteoarthritis. We see a lot of patients in the Pilates studio who have osteoarthritis. It's the most common form of arthritis in the UK and affects over 10 million people. Now, what is it? It's a condition that affects your joints and your joint surfaces, and it can cause pain and stiffness in the joints. It usually affects your weight-bearing joints, so normally your hips or your knees, and also quite commonly the small joints in your hands. The symptoms that you might get from osteoarthritis really vary greatly between people and between joints in each person as well. So as I said, you might get pain or stiffness of the joint. You can also get swelling and sometimes creakiness or clicking around the joint as well. So our joints, like the rest of our body, do see changes over time, and normal healthy joints will have a kind of ongoing process of a little bit of damage and repair, and we don't really get symptoms from that. As we age, it's normal to see changes in our joints and our joint surfaces, just like we see changes on the outside of our body as we age. But in osteoarthritis, the cartilage, which is the protective kind of layer of tissue around the joint surface, can get a little bit more worn down and damaged. And the body struggles to repair this. You can also get changes within the bone around the joint as well. And these are the things that can lead to the pain and swelling that we see as the external symptoms of osteoarthritis. We don't really know the exact causes as to why some people get osteoarthritis, but there are certain things that can increase your risk. So that's if you have a family history, if you've had damage to a joint through an injury or perhaps a broken bone through the joint, if you've got previous damage to the joints through rheumatoid arthritis or gout. Females are more likely to have osteoarthritis. If you're obese, you're more likely to have osteoarthritis. And I think, as most of us know, it's more common as we age, as we get older. So how do you know if you've got osteoarthritis? Well, it's normally diagnosed by your GP, and that will be a combination of them examining your joints, listening to the history of your symptoms, and having a look at x-rays of your joints so that they can see what's happening on the joint surfaces and the condition of your joints. All of those things together can give you a diagnosis of osteoarthritis. One of the things that we know, which is really important, is that your symptoms don't necessarily correlate to your x-ray findings. So that means we can see x-rays that show what would look like a lot of arthritis within a joint, but that person might not necessarily be feeling any symptoms. And it's those symptoms which are really important, because that's going to determine how much your function is affected and your quality of life is affected. Conversely, we can also see people who don't really have many changes on x-ray, but they're getting a lot of symptoms. So there's other factors involved, like exercise, muscle strength, and joint flexibility and movement, that can have a really significant effect on your symptoms without us actually having to change the quality of the joint surfaces. So what is the treatment for osteoarthritis? Well, exercise should be top of the list. I know I'm biased as a physio and Pilates instructor, but there's really good evidence to show that exercise can help to reduce your symptoms and improve your function, improve the activities that you're doing on a daily basis. If you can strengthen the muscles around a joint, this has been shown to help to support the joint, perhaps offload it, take away some of the load and forces that are having to go through the joint, and therefore reduce your symptoms. So for instance, if we're talking about osteoarthritis in the knee, if we strengthen up the quadriceps on the front of your thigh, the hamstrings on the back, and your calf muscles, that helps to distribute the forces through the leg better so that the joint is less overloaded. It's less likely to cause you pain if you do have arthritic changes. So there's other benefits of exercise for osteoarthritis as well. It's going to improve your balance potentially, so that you are getting less movement around the joints. You're more controlled and steady through your body and your joints, which means that there'll potentially be less irritation around those joint surfaces. It's going to improve your joint mobility, so that will help with your function on how much the joints can move. It helps with the movement of the fluid around the joint surfaces, which helps with the health of the joint surfaces and the cartilage. And it will also increase the blood flow to all of those tissues around the joint surface and your muscles surrounding the joint as well. Advice and education are really important in the treatment of osteoarthritis. Often people are fearful of what they can and can't do, and they think that perhaps too much activity or exercise is going to damage their joints further. And actually, the opposite is true. Movement and activity levels are more likely to improve your symptoms and improve your function. So getting that reassurance and that understanding of the things that are going to benefit your body and your joints and how to manage the loads that you're putting through your joints on a daily basis is going to be key. Other treatments that you might see for osteoarthritis are taking painkillers or anti-inflammatories, perhaps injections into the joints. Also advice on footwear and adapting your movement and your function so that you don't put too much pressure through your joints. Weight loss is often important for patients. And then obviously there is surgery to the joints, joint replacement surgery. So we've talked about exercise. What about Pilates specifically? Well, Pilates is an excellent form of exercise for osteoarthritis because it is low impact. So we're not going to be heavily loading your joints. We can modify it specifically for you. We can work on your muscle strength, your joint range of movement, your balance. We can also look at your whole body, not just that one joint that's irritating you. And often it's that whole body integration that helps to take the pressure off the painful joint. It's also really progressive, so we can start at a really low level using the assistance of the equipment, the assistance of the springs on the equipment in the studio, and gradually progress it as your body adapts, and making sure that we're working up to getting your muscles strong and active in a weight-bearing standing position. We can make it really specific for your functions, your activities, perhaps your sports, so that you can have as best quality of life as possible. In the blog below, you will see some examples of Pilates exercises that we use on a regular basis in the studio for people who have osteoarthritis. These are using our Pilates equipment and show you how we can use the assistance and resistance of the equipment to benefit you, your joints, and your whole body function. If you've never done Pilates before, or you want to find out a little bit more about doing Pilates with us to help you if you have osteoarthritis, then please do get in touch. If you have any questions, we'd be happy to help, happy to answer questions, and we can always get you booked in for a session either in the studio or online so that you can be doing exercise at home.